Okay.
Hello, everyone. This talk is on which words can literally cause your diabetes to become more difficult to manage. Can you believe that? Hi, I'm Theresa Garnero.
And I'm Stephanie Bouquet, and we are both diabetes educators. I'm a registered dietitian, and Theresa is a registered nurse.
That's right. And yeah, I wanted to ask you, how many of you have used any of these words? Poorly controlled, pre-diabetic, non-compliant, or diabetic? And what's the deal with these? Why is it why are we talking
If,
about this?
right. And if you haven't, have you heard your provider mentioning those words to you?
Right, that's right. I mean, if you think about it, would you say canceric? Would you say hemorrhoidic or demented? No,
Right.
you wouldn't.
I
You
mean,
would
they
say,
sound silly, right?
yeah, it does sound silly. You would say has cancer, has hemorrhoids, has dementia. Hopefully not all three. Why not? Because people come first, not their disease state. And really, words do have a lot of impact. Um, This is a new standard of care from the American Diabetes Association and the Association of Diabetes Care and Education Specialists. And there are some principles about diabetes. We all know it's a complex, challenging disease. There are many variables, but the important thing is to put the person first and use messages that are strength-based, that empower someone and can actually improve communication and motivation and well-being. Because it's just, you'll see what I'm talking about here in a minute when we kind of compare and contrast. But essentially, we're trying to avoid the stigma that has been associated with diabetes. There's a lot of shame and blame. You did this to yourself. I know we've talked about that a lot. But it can really add to the diabetes distress and burnout and really just leave you not really feeling motivated. So the guiding principle here is to be respectful, to be inclusive, to be person-centered, and that helps to remove some of the shame. Would you ask somebody to think like a thyroid or gland or an ovary or a pancreas? No, of course not. But we're kind of expecting people. Here's a pancreas thinking about, okay, here's all my numbers. Wait, I got to watch out for this. Oh, now they're going up and down. What's my insulin to carb ratio? What should I eat? What about my medication? Oh, here's my insulin pump. I need to get in my exercise. There's all this mind space that's going on trying to manage diabetes. And so if we look at the difference between or some of the types of words and why this is important, let's look at the strength-based language. This emphasizes what people know and what they can do, and it focuses on what they're already doing and that they're doing the best that they can. So instead of, oh, he skips his insulin on most days, it's like, no, he takes his insulin on time, 50% of the time. There's a difference in that it removes the shame. Really, we're looking for positive attitude and using dignity, not like trying to, I don't know, be mean to people who are just trying to do their best. It emphasizes on the person rather than their disability or their disease. So we're going to get a little bit more into this, but I wanted to stop and, Stephanie, you have experience here being, your husband has type 2. So what have you seen in your role, how this plays out?
Well, I mean, I think as being, a support person for someone that has diabetes, but also as a provider dealing with individuals that have diabetes, I mean, I wouldn't ever say, what are you eating that for? You can't have that, or, that type of verbiage. Instead of saying, well, that's a really enjoyable food, and maybe we can have this sometimes when, and other times you might want to pass on that and have something different. So just kind of letting them be in the driver's seat versus myself, I guess. But it's hard. It's hard to stay neutral and non-judgmental, but it's important. It's super important for their success, right? So I
Right.
like some of your language here.
It's true. Like how often have you had the experience where, your blood sugar's high and somebody says, well, what did you eat? It's like,
Right.
hey, wait a minute, if somebody's having pain from cancer, well, what did you do? It's just kind of,
Right.
people feel like they have a license to judge about your food choices, and, it might not have anything often it has nothing to do with the food. So this is really using language that's free from any kind of stigma or judgment. It's respectful, it's inclusive, as we talked about. And this is important because those thoughts that happen when somebody says something negative, it sort of becomes, it leads to action or inaction. Like if you go in and your A1C is not at target and your provider says something like, well, if you only took your insulin more on time, you'd be like, oh, great, that's so motivating. And a lot of time that inspires people to not take action. And that, in fact, has the consequence of some of the possible complications that we can see over the long haul. If, you don't feel like you're supported, you don't feel like your efforts are counting. So it is important to check how you're talking to yourself. Some of this will come from providers, and they don't understand. They didn't get the memo on the new standards, which are more than 5 years old, and they still call people diabetics, which is
All the time.
Yeah, it is. It takes a long time to change, and it is considered an inflammatory word. But you can start with how compassionate you are with yourself. What kind of words do you say? Are you saying, oh, you're just, you're bad, you're not doing right, and this is all your fault? It's like people see that number and it's like, oh, this is, you've done this, instead of it's just data.
Right. You're not defined by a number.
That's right.
Mm-hmm.
In fact, here I highlight, there are no good or bad blood sugars. There's just information. So you focus on your efforts, not the numbers. The only bad number is the one that doesn't exist. I like how one of my colleagues put that, because it's information. Here she's looking in the mirror. It's a way to get feedback. So instead you could say this number is in range, it's above range, it's below range, below target. That has a lot less shame. It has no shame. It's just fact. This is above target, this is below.
Right.
You can start saying to check your sugar instead of test sugar. Now we're getting into some finer points here, because you can fail a test. But if you're just checking, you're just looking.
Just saying, sure.
And there's the language also applies to weight. So instead of saying, here's an overweight person, it's like you're putting, again, the condition before the person. I'm not, a lot of people say I'm fat. Well, no, my name is Theresa and I have overweight, and that kind of sounds weird. I have extra weight,
Carrying extra weight. Right.
I'm carrying extra weight. So do check those inner voices.
And, I'm thinking, Theresa, you could even do this with foods that you're eating or your food choices. There are no good or bad foods. There might be habits that are with those foods that need to be changed, but there's not a bad food. All foods can fit. Might be in smaller amounts.
Right. That's right. So you want to try to avoid labeling blood sugars as good or bad, because that can then be incorporated into you thinking you are good or bad. If you want to get more into the nuance of this, you can pause this video and read through this, but you'll see like what's problematic, what is preferred, and why. We've talked about some of these things like poor control. I mean, you could have the same meal, the same 3 meals for all week, and your blood sugars are going to go all, you can't.
Because there's so many other variables. It's not just what you eat, Absolutely.
So diabetes control is considered sort of like an oxymoron. It's like, challenging at best. It does take time to change language. So here are some final pointers. Instead of diabetic or pre-diabetic, he or she or they have diabetes or pre-diabetes. Instead of control, you're managing. You're doing your best to manage. Instead of good or bad numbers, these blood sugars are in range. Okay. And then I was bad, oh, I was bad. I had that cake, just say this is hard work and I had a setback. It just, it takes the blame out of it.
Right.
All right. Dr. Bill Polanski, a renowned psychologist in the world of diabetes, says, people with diabetes do what anyone else does. Very few of us can follow every single health habit or change. So we choose the ones we can. And that's
Terrific.
Yeah, that's about what you can do, and just try to be a little bit more gentle with yourself.
Sounds great. Everybody needs to be the best that they can be.
That's right. Thanks for watching.
Thanks.